Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Today on the podcast, I'm speaking to Professor Greg Irving, an academic GP and the National Specialty Lead for General Practice at the National Institute for Health and Care Research, or NIHR. In this conversation, we discuss the essential role of research in general practice and how it's being embedded into the government's 10-year plan. Greg explains the various ways the NIHR supports and funds research in primary care and offers practical advice for practices wanting to get involved. He also addresses common concerns about the workload associated with research and highlights how it can improve quality of care, boost job satisfaction for the practice team, and help tackle health inequalities, and how general practice is uniquely placed to lead research into complex challenges like multiple long-term conditions. GP Online has joined forces with 5 essential healthcare resources to create the MIMS Healthcare Network. Since 1959, our Haymarket healthcare titles have supported primary and secondary care audience across the UK through individual publications and specialist events. We're now entering an exciting new era with the launch of MIMS Healthcare Network, linking together our 6 leading media brands to serve the entire healthcare community as one. The MIMS Healthcare Network covers GP Online, GP Business, MIMS, MIMS Learning, MIMS Learning Live and MIMS Pharma. By bringing together these resources, we aim to provide a seamless experience for all healthcare professionals and the organisations that support and supply the UK health sector. The MIMS Healthcare Network, covering every aspect of primary care. For more information about our subscriptions, visit GPonline.com/subscribe. I'm delighted to be joined on the podcast now by Professor Greg Irving. Greg is an academic GP who works in general practice and is also Professor of Primary and Integrated Care at Edge Hill University. Alongside this, he's the National Specialty Lead for General Practice at the NIHR, the National Institute for Health and Care Research. Thanks so much for coming on the podcast, Greg.
Thank you for inviting me, Emma.
We're here today to talk about research in primary care in general practice. And I mentioned there at the start that you're the National Specialty Lead for General Practice at the NIHR. Can you explain a bit about what the NIHR is and what it does and what your role there is?
So the NIHR, also known as the National Institute for Health and Care Research, is funded by the Department of Health and Social Care, principally to improve the health and wealth of the nation through research. We work in partnership with the NHS, and that includes general practice, universities, including those departments of primary care, local governments and other research funding bodies, and crucially, patients and the public as well. We have a few roles, and that's principally to fund, enable and support the delivery of health and social care research that improves people's lives. And you often hear the NIHR talking about the 4 I's. It drives improvement in the NHS through impact, inclusion, innovation and investment. And it's a great time to be talking about research in general practice in the primary care setting because the NIHR is just celebrating its 20th anniversary this year. So it's a really good time to talk about that. And we've obviously seen a lot of activity around primary care research in the long-term plan as well.
So you're a frontline GP as well, but also Professor of Primary Care and a researcher, and you've been an academic GP for your whole career. How does the daily pressures of general practice inform what you actually choose to research?
I've worked as a clinical academic GP throughout my career. I still work as a frontline GP as well, if you like. I work in a practice that serves a relatively deprived community as well. So we see those challenges on a day-to-day basis. I've always found that clinical practice informs my research and vice versa. And indeed, some of the best questions that I've come up with have often been from those conversations with patients and colleagues. Within the NIHR and the RDN, we have a network of other regional specialty GP leads as well. All of those work clinically as well. So we have a really good network of informed what's going on across the country. Some of the key challenges that we see at the moment, and they're reflected in the NIHR's strategy as well, key challenges like multiple long-term conditions, and GPs have for a long time been at the forefront of research in that specific area. continuity of care, all those big challenges that we see, how services are designed, much of that is born out of conversations in general practice. And as I say, a lot of the priority setting work that goes on within the NIHR engages GPs and the patients as well. So we see it across, the NIHR talks about a one NIHR approach. So whether it be funding, research projects, infrastructure, delivery, it's all done with engagement with general practitioners and patients and public.
You mentioned the 10-year plan earlier. We've talked about that quite a lot on this podcast. But one area we haven't really talked about is research. And as you mentioned there, a key aim of the 10-year plan is embedding research in general practice. Why do you think that's so important?
I think it's fundamentally important. So as you say, we've got the three shifts: hospital to community, analog to digital, disease to prevention. I think general practice sits in the sweet spot of delivering on all three of those, and I think that's been increasingly recognised. Some other funders, like the Wellcome Trust, for example, call for a fourth shift alongside those three, and with that being from research to reality. They're kind of embedding research in that, and I think that's been recognised in the 10-year plan. To come back to your question, it's fundamentally important in terms of, well, first and foremost, there's a trusted relationship between the general practitioner and the patients and population that they serve. And that's incredibly important from a research perspective as well, maintaining those relationships when it comes to engagement in research. That is really, really important, not to be underestimated. The NIHR puts a strong emphasis on inclusion as well. As I say, as someone who works in a relatively deep end practice, if you like, that is fundamentally important as well, engaging those populations, helping to strengthen action on health inequalities. Because if an intervention is to be developed, it needs to be done with consideration of the population it's going to be applied to down the line. If it's developed in a population and then applied in another setting or another locality or in another population, that's going to have real challenges when it comes to how well it's implemented ultimately. The typical example is studies what they've been developed in white male populations, mainly in the US, but then we attempt to apply that to maybe a diverse population in a primary care setting, and that can be really challenging then, and you can sometimes see interventions falling flat as a consequence of that. It's really important, not just from I guess like a moral standpoint, it's important from a scientific standpoint as well.
The government wants to do more research in primary care. It sees it as really important, like you say, to drive these three shifts. So what's the NIHR doing specifically on research in general practice at the moment?
There's been a lot of activity around how we can essentially step up primary care. I should say that's off the back of a period of real growth and activity in primary care research. And primary care research certainly stepped into its own during the pandemic. So we saw flagship studies like the Panoramic study, for example. It was one of the fastest recruiting trials in primary care history. The general practice community was absolutely key in driving that and forming those collaborations and delivering well. And I think that's been recognised and acknowledged. So to come back to your question about what's been done, so in terms of stepping up primary care, there's quite a lot of recent activity. Like, for example, there's been capital investment funding around supporting the infrastructure in primary care. And there's a call actually open now for that, where practices can bid for up to £300,000, for example, for supporting and developing the facilities to broaden the scope of research at delivery and increase the capacity. So that's a bit of infrastructure, if you like. There's funding around what they call wider care setting funding that's been incredibly popular and been taken up by many practices in terms of supporting and remunerating practices for that activity, as well as the kind of importance of delivering research itself for its own sake. It's often an important funding stream for practices as well that they can open up into. So that wider care setting funding has been incredibly popular, and it's performance based in terms of like how much activity a practice does, but that's an incredibly important funding stream there. There's some strategic funding as well for opening up into new areas, and we've seen some regional strategic funding in relation to that as well. I guess a really big piece of activity that's gone on recently was around the primary care commercial research delivery centres as well. So this was a multi-million pound, just over £10 million worth of funding for supporting 12 primary care research delivery centres. So this is fundamentally about broadening the scope of what primary care research can do. And engaging with the life science industry, which is also a key part of the 10-year plan as well. So I think that's a real testament and an acknowledgement from government and the NIHR in relation to that primary care really has stepped up over time, and it's put its money where its mouth, if you like, in terms of committing to that.
What is the current situation in terms of research and general practice? I mean, do we know how many practices in England are involved in research?
I mean, there's different reports, but one recently was looking at around 48% of practices are engaged in some
Right.
form of non-commercial research, and that's the majority of activity that we see. In terms of those that do commercial, I'd say it's about 6.5 at the moment. They'll do a mix of what they call non-commercial and commercial research. In terms of some of those primary care research delivery centres, that's less than 1%. So there's 12 of those funded in the country. So the majority of practices will be in that kind of like 48%, probably doing the non-commercial research. There's real potential for growth there as well. So there's probably just over 40% of practices that are not engaged in research, and there's massive opportunities for them. So looking at all the activity that's taking place within the NIHR and the RDNs, there's great opportunities for growth there within that those practices that aren't currently engaging, I think.
If there's any of those practices listening now, what would you say about why they should engage with research and how they get started with it?
Yeah, so I can think of a practice just down the road from ours that wasn't research active. It was very worried about the burden doing research activity would put on the practice beyond
Yes.
all the activity that they were currently doing. And they were worried about, having to do swabs, having to do lots of practical interventions. So we had some conversations, and we were very much supported by what they call the RDN, the Regional Research Delivery Networks. And they have an agile team that came out to that practice and taught them through how to engage. And that can include some practical things like doing light touch studies. It can be as simple as running a search and maybe messaging out patients and inviting them to take part in research. It doesn't mean you have to engage in really complex commercial interventions right from the off. There's often a bit of a process here about engaging and learning to run before you can walk as well. But as I said, those agile teams and the RDNs are highly experienced at supporting practices, particularly if they've not done anything before. It can also be challenging for practices. There might be partnerships within the practice and convincing other partners that it's worthwhile doing as well. So there's increasingly some good evidence that engaging in research improves the quality of care that's delivered, and that it's good for practitioners, good for the practice overall, good for the population. So we've got some materials as well, and the NIHR School for Primary Care Research have really developed some very nice materials at supporting practices to engage as well. So I think that's a really important message to get across.
There is a funding element to it as well. Practices do get paid for doing this, don't they?
They do indeed. So as I say, the principal mechanism for the funding is wider care setting funding. And there's a really comprehensive website with all the guidance and videos for supporting practices about how to access that. I think a lot of practices simply aren't aware that that exists. It's not expecting you to be a professor of primary care. It's about how to engage in a very light touch way, as well as there are practices that will want to move on from doing some activities to doing more and scaling up activity as well. So it's set up in a way that will support a practice no matter where it is in terms of its own development and maturity from a research delivery perspective.
Yeah, I suppose it comes back to what we were talking about earlier. Research needs to be inclusive. So basically what you need is people who are doing it on the ground with real people who live in communities. And that's the only way you're going to get answers to some of the questions we've got.
Precisely. And if you look, this is happening at a really high level as well. So if you look in the NIHR RDN's 5-year strategic plan, there's a whole section in there about activity that needs to take place, about strengthening that kind of inclusion and health inequalities, particularly from a general practice perspective. There's lots of activity around those deep end practices and how they can be best supported, because we do know that they often, in terms of the burden of disease that sits in those practices, it's often amplified and specific challenges that those practices face. So we are actively looking at how we can best support nationally.
How does commercial research work? Does that work in a very different way, or is it sort of similar? I'm assuming there's potentially more funding attached to that than there would be other stuff.
So again, if you were a practice looking to engage in commercial research, there's often a bit of a natural progression. You might go from engaging in a light touch conventional portfolio study and then moving on to commercial. But even some of the commercial studies can be light touch as well. Again, just inviting patients to take part in activity and things like that. So there are some light touch commercial studies, but you are right. For the majority of them, they're often a bit more involved. You often need to have your kind of mechanism set up for supporting delivery. Again, the agile teams are very good within those regional research delivery networks, are very good at supporting practices if they want to scale up and look at doing that activity. There's also a mechanism called a national contract value review as well, which is again like a contract that practices can sign up to, where they'll be offered commercial research as well. And again, the agile teams help to coordinate that and offer studies that are appropriate for the practices. As I said, they're a highly experienced team, and they know through the conversations with individual practices where they're up to, what they might be able to handle. It's really good to have those relationships, and I think that's a really key strength of the RDN nationally.
Yeah, I suppose because that must be a real concern for practices as well, mustn't it? That they don't want to take on more than they can actually cope with. So if there's people who can help them assess that, that's probably quite useful.
It is indeed. And they will give them a bit of a sense check in terms of what's reasonable and feasible, look at previous performance, how they've performed within other studies as well. But also, particularly like those primary care commercial research delivery centres as well, a lot of them have outreach and enablement kind of function to them as well for supporting other practices. And I think they're quite keen to collaborate. There's a lot of expertise out there, both on the general practitioner side and in terms of those agile teams that can support delivery as well.
Do you think commercial research in primary care, do you think that's something that we're going to see kind of a big expansion of over the next decade under the 10-year plan?
So I think particularly when you look at the NIHR's 5-year strategy, that is, I guess, a key part of that function. And there are ambitions internationally to kind of step up the game within the country as well. So I do think we're going to see more and more activity in that space, more engagement with life science industry. And as I say, they kind of like offer for infrastructure, workforce, portfolio to support that activity. I think we'll see that follow as well.
Because obviously historically, like a lot of funding for clinical trials and stuff is centred around hospitals. Maybe that's partly because of the treatments and stuff that are in development. Is that something you're also working on, is making sure there's a better infrastructure for funding and clinical research, like commercial research as well, in general practice?
That's one of the key functions of the RDN for supporting that activity. There are other parts of the NIHR as well that support that activity as well. The NIHR Academy, there's an NIHR industry hub as well. So there's multiple parts to it, and we do all work together very closely. As I say, we take that kind of one NIHR approach to make sure the right part of the NIHR is supporting the activity that's needed. I think we are going to see an expansion. As I say, there's, I think, training that workforce, putting the infrastructure in place is an absolutely key ingredient for supporting that activity. And then I guess the other thing I often hear from practices is about developing a pipeline that's appropriate for supporting general practice. So there's some really nice examples across the country, be it vaccine-related studies where primary care is delivered extremely well. The panoramic study is another really nice example of that, where it's delivered at scale and developed some really nice findings there as well. So I think there's multiple ingredients to it. I think people are mindful about, I guess, like the education side of it for supporting that activity that needs to go along.
Do GPs need to do extra training or education before they take on some of these projects, or is it something that they can just do as part of their normal experience?
Good question. So yes, to conduct any kind of like research delivery, there's what they call good clinical practice certificate that a practitioner would need to complete. That's relatively light touching, doesn't take too long to do that. There are those that want further support and training within that. There are some nice examples up and down the country of GP trainees that have roles in supporting delivery as well. So that's really nice to see. And we've got some commercial delivery fellows as well that have supported activity as well. So we're starting to see that pipeline of workforce being supported as well. That's great to see. I know the Royal College of General Practitioners have done a lot of really good work in this space as well, looking at GPs with enhanced roles as well.
You've mentioned research hubs, and your practice is actually a research hub as well. What does that actually involve, being one of those hubs?
It was born out of collaboration across so I sit within the Northwest RRDN, and it was a bit of a network of those more research active practices across that patch to form one of the hubs. It was a bit of a competitive process where we looked at capacity building and infrastructure that could go in to support research delivery. And it was very much built on a kind of like hub and spoke model where some practices might support those around them in terms of activity as well. And I think that's a key question for the NIHR at the moment, is that what's the optimum models for supporting the delivery? I mean, that's just one example. There are others up and down the country. But yeah, working in partnership, supporting primary care networks in a given place and supporting the practices around them. There's been some real advantages to that. Like as I say, on our patch, there's been some practices that are not research active, and we've been able to support them, work together in partnership, and they've seen the benefits of taking part in research and very independent now and can conduct their own portfolio of activity.
Is that sort of the advice you'd give to people, is you can start small and then build out from there as you start to get a bit more confident with doing it?
Yeah, I think that's a very kind of practical way. I would say reaching out to your local RRDN is absolutely key. Have a really good look on the NIHR RDN websites where there's offers of funding and support that's there. There's lots of material on there, and it's very well maintained and up to date from that perspective. And get to know those agile teams that will work across your patch. They'll quite often come out to practices, come out to practice learning events, and support that community to take advantage of the full scope of what's on offer, really.
You've talked about some of the benefits in terms of how it can help improve care and improve things for patients. Are there any other benefits? Is it something that's kind of quite a good activity to do as a team within the practice? Is that one of the benefits you see as well?
Just coming back to that study that was conducted by the NIHR School for Primary Care Research, and I guess in a lot of the post-pandemic reports as well, there was an NIHR report following the panoramic study. So it highlighted a number of advantages. So as I mentioned, for practitioners, general practitioners, many of them have portfolio careers, and it can be quite satisfying to have something a little bit different than just clinical work. And there's a lot of interest in that space. So they can see direct effects and indirect effects related to that. So maybe some enhanced job satisfaction there, some enhanced skills that, we mentioned the training that's needed to conduct it. And there is like a body of expertise that you start to build up from supporting research activity. For the practice overall, there's increasing evidence that it's demonstrable improvement in quality of care that's delivered as well. And that's really, really important. It might enable extra equipment, facilities, and obviously the benefit of the research itself. You might have access to interventions that you wouldn't otherwise have as well. For patients, it can improve access to certain treatments that might not be widely available as well. A nice example, certainly in our patch, was one recently whilst patients were on child and adolescent mental health waiting lists. There were interventions that patients could access. It can contribute to, I guess, like supporting the evidence around guidelines for patients as well. There's that direct kind of benefit there, and can potentially reduce hospital admissions for patients as well. The other one to mention is about the benefits to a practice population as a whole. So there's growing evidence that it can help take action on health inequalities. And that is a fundamentally important component as well. And finally, the wider economic benefit. So the widely cited figure is for every pound that's invested in research, it returns about 13 to the UK economy. And primary care, there's a lot of activity in primary care, and it's a bit of a hidden but very important contribution that primary care, I guess, like makes to the UK economy as well.
Do you find it's quite easy to get patients to kind of take part in research as well?
Yeah, given the nature of general practice, as we mentioned before about being a trusted environment that's accessible, I would say that it's particularly well suited to supporting recruitment and activity. There are situations where people have tried to set up studies outside of that infrastructure that have not always gone quite so well, because they haven't got the relationship, they haven't got that long-term relationship that you often need for following people. Sometimes for some studies might be following people up for years and years afterwards. That kind of relationship really matters, and access. So the type of research that you see the NIHR conducting, it might be on patients who are elderly and frail and with dementia as well. General practice is particularly well placed for supporting those populations. It's getting an increasingly strong track record in terms of performance from that perspective.
What do you see as being the key areas where research in general practice is going to be focused on over the next few years?
Yeah, there's probably several key areas, but one that comes to mind and is written large in the NIHR's 5-year strategic plan is multiple long-term conditions. There's a real challenge there. You've heard chief medical officers and others state that fact. I think it's almost a daily conversation in general practice about the challenge that presents and everything that goes around that as well. There is like a cross NIHR approach to trying to tackle multiple long-term conditions. I think that is a really exciting area for research, that general practice and primary care is particularly well placed. We see it in a lot of priority setting arenas across the NIHR, be it in the funded programs, within the RDN, within the academy, and as I say, across the NIHR. So I think that is a really important hot topic and a really challenging and wicked problem to try and take on.
Some of the clinical complexity that GPs have to deal with now, because they are dealing with people with multiple long-term conditions on a range of medication, it is really challenging, isn't it?
Absolutely. And we see that also written into, I guess, like within the 10-year plan, that focus on multiple long-term conditions is a key part of the shift to modern general practice, neighbourhood working. It's written and embedded throughout that. So when we think of what's going to be a priority of the next 10 years, that is definitely going to be one of the key areas. And it's everything that goes around that, the patient-centred care, the interventions that are needed to support that, work around continuity of care, all of those key areas, and the outcomes as well for patients as well, the patient experience and all the outcomes, all of that really matters, and how the service is designed. So there's lots to get into. But yeah, as I say, that has formed a key part of the RDN's 5-year strategy. One of the key points I was going to make today is within the RDN, they've recently created it's the first time they've had general practice as a speciality. One of the benefits of having that is that we've got really good interface with all the other specialities that sit within the RDN. So be it respiratory, cardiovascular, renal, all of the conditions that touch on multiple long-term conditions, there's a really good dialogue there about how to best manage services. And that kind of interface and how research occurs across settings is really, really important as well. So we've had some really good conversations about how we could do things differently as well. And I think certainly with the shift to moving research activity into like primary care setting, they're increasingly keen to have that dialogue as well about how best to engage.
Do you think that research is going to become a key part of what neighbourhoods will be about as well?
Yeah, so obviously within neighbourhoods, there's a strong emphasis on quality improvement and activity within in neighbourhood teams. Strategically, there's an increasing recognition that we need to look at how research is embedded within neighbourhood teams as well. And we are seeing some nice examples of studies that are in that kind of like neighbourhood space. Certainly one on our patch was looking at community assets for children, young people's mental health and things like that. So there's certainly lots of activity starting to happen within that space as well. It's a complex area, and it will certainly need work across multiple stakeholders to look at how that's actually achieved.
That's brilliant. It's been great talking to you today, Greg. Thanks very much for coming on the podcast.
Thank you so much, and thanks for your time, and thanks for giving us the opportunity to talk about research to the GP community. It's really appreciated.
Well, that's it for this week. Thanks so much for listening, and thanks again to Greg for taking the time to talk with me. I'll be back next week for our regular news review, so please do join me then. In the meantime, don't forget you can keep up to date with all the latest news affecting general practice and access lots of other resources on our website at GPonline.com.